Welcome back to CLE Weekend. It is Cancer Prevention Month, and we are on a mission to empower you with the knowledge and the tools to stay ahead of the fight against cancer. Dr. Blanda, Medical Director from Buckeye Health, is here to talk about cancer prevention and early detection. So let's first talk about what maybe are some of the most common cancers that we hear about.
So in Ohio, unfortunately, most of us know someone who has had cancer.
Yeah.
And it is known that 70,000 new diagnoses of cancer were made in Ohio last year.
Wow.
And 4 out of 10 people will be affected by cancer in their lifetime. So the most common types of cancer are prostate cancer, lung cancer, colon and rectal cancer, breast cancer, and the other one people don't think about is melanoma, which is skin cancer.
Yes, you're right. Okay, my mom, she has had melanoma many times. So for me, top of mind, I do think about that stuff. But you mentioned a lot that you're right. Either we know someone or we know someone who has had these. Early detection saves lives. Talk about this.
So early detection is that concept of screening to look for cancer ahead of time. And so it is known, the American Cancer Society tells us that early detection will prevent death in cancer. And early detection is that ability of looking for the cancer ahead of time.
Yeah. Now, screenings, how does this work? I mean, do we see the doctor first and they say you should get screened for something, or is this something we should really talk to the doctor about?
So it's important, screening is based on your risk factors, and risks are based on your age, on your gender, on your family history. So you want to meet with your doctor. But there are some general recommendations that are made to the public by the different medical societies. For instance, prostate cancer is recommended for men over the age of 50 on a regular basis. The other one is mammograms for women for breast cancer screening. This should be done yearly. Some societies will say every other year, but the American Radiology Society says that it should be done yearly. And the other ones that we screen for that can be done are the colorectal. So that is done at age 45 to 74. It used to be 50, so that age has gone down. And the last one that people screen for is lung cancer. And lung cancer is not for everyone, but if you've been a 20-pack-a-year smoker, you've recently quit, you've smoked for 15 years, or you're between the ages of 50 and 80.
Now, if we want to reduce the risk for some of these cancers, I mean, there are ones that are more preventable, like you're saying, when we're talking about lung cancer, don't smoke.
So there's a big one. So lung cancer, it is known that 1/3 of cancer deaths related to lung cancer would have been prevented if we removed tobacco products.
Wow.
So that idea of really thinking about quitting, it's the beginning of the year, so it's a good time to take on that as a resolution. And also, the other thing that people don't realize is that diet and obesity are related to 13 types of cancers, the cancers that we talked about.
Wow.
And so having a healthy lifestyle, eating non-processed foods, exercising regularly. And the other thing is, sun exposure. So we are in Northeast Ohio, and so when the sun comes out, we do want to go out, but the fact of the matter is, you need to wear sunscreen, protective clothing, and avoid tanning beds.
Even when it's not a bright sun, too,
Right.
You still need to put on that sunscreen every day just to protect yourself. Let's talk about family history. I obviously said my mom has had melanoma. So family history with cancers, that's something we should all really know.
Yes, so it's important to know your family history, to discuss it with your doctor, to discuss the tools and the preventative screenings that are available to you. Remember that those screens are fairly non-invasive. The majority of them are going to be covered by your insurance, and so it's easy to do.
Yeah, there are some people who fear going to the doctor because they don't want to hear what they're going to say, and then they have to face whatever that is. What do you say to people who are like that?
So it's normal to be have a little bit of anxiety relating to testing. I mean, testing anxiety is a well-known thing. So the idea that a patient would be a little bit nervous, that's normal. But the fact of the matter is the American Cancer Society tells us that early detection will allow you to save lives and decrease your rate of death. The other thing is that your treatment may not be as aggressive and it may not be as prolonged.
Oh, okay. That's definitely a big deal, too, for people to know. The Buckeye Health, of course, you guys have this plan. You assist people. They can come to you and you guys make it very easy.
So Buckeye Health is a health guide to our members. We try to get them to have preventative screening. And so it is offered to them with no copay. The other thing that is available to them is the My Health Pays, which is a reward incentive system that allows members to get paid monies for doing the testing, and they can use those monies for things like personal care items, or they could use them for healthy foods and things like rent and utilities and childcare. The other thing that the plan does is it really tries to make providers available to people. Sometimes it's hard to find a provider. So we have My Provider tool, and then they offer transportation to people that is scheduled 48 hours in advance.
Oh, wow, that's wonderful.
Yes.
Anyone who wants more information on Buckeye Health, where can we go to get that?
More information is available at buckeyehealthplan.com.
Wonderful. Dr. Blanda, thank you so much. I appreciate all the information that you gave us here and preventative ways with a lot of these cancers. We'll be right back on CLE Weekend.